community. The amount of funding our neighborhoods receive to support hospital and medical resources, healthcare services, child care centers, parks, Head Start programs, and affordable housing are all guided by the information collected on the census. Completing the census is mandatory for everyone. However, in 2010, Los Angeles County had a significant undercount, which meant our region lost out on hundreds of millions of federal dollars. This year, communities cannot afford to miss the opportunity to ensure necessary funding goes to crucial programs for our residents. More importantly, during this time of crisis, getting an accurate count will help Los Angeles County garner resources it needs to protect and support our communities, your communities. Your information is confidential and under federal law can only be used by the government to produce statistics. Everyone must be counted regardless of age, ethnicity, zip code, or immigration status. If you haven't completed the census yet, please do so. You can do it online, by phone, or even by mail. Visit my2020census.gov. Again, that is my2020census.gov to complete it. And go to census.lacounty.gov for answers to frequently asked questions. I want to thank you in advance for participating in the census and supporting the needs of our region. Now, I would like to introduce Dr. Barbara Ferrer, the Director of Los Angeles County Department of Public Health, to give you the latest update today. Thank you.
Good afternoon, everyone, and thank you so much, Supervisor Barger, and thanks to the entire Board of Supervisors. Their efforts and their leadership are making a difference in our county. We're all extraordinarily lucky to have such committed, dedicated leaders and such insightful leaders that are really setting the path forward. I also want to acknowledge and thank both our partners at the city, the mayor, the mayor's office, and our partners at the state, the governor, and all of his team, particularly the public health director and Dr. Mark Galley, for all of their guidance and support. You know, it does require that we have a coordinated effort across the entire state with our large cities, and I couldn't be more proud to be part of this team that really is responding in a coordinated and collaborative fashion. So thanks to everyone. I want to update you again on our current status today. Once again, I'm saddened to report that we have 11 additional deaths today. 9 of the people who passed are over the age of 65, and of those who died who were over 65, 7 people had underlying health conditions. The other 2 deaths occurred among people who were younger. One person who was between the ages of 18 and 40, and the other person was between the ages of 41 and 65. Both of these people had underlying health conditions. This brings the total number of deaths to 65 in LA County, and our mortality rate for COVID-19 remains at 1.8%. 88% of the people who have been who are positive for COVID-19 and have died did have underlying health conditions. But as I've noted, some people who unfortunately have lost their lives do not have underlying health conditions. Every day reporting these numbers is devastating, and I know it's more devastating for the lives of the families and friends who've experienced this tremendous loss. I'm so very sorry for your loss, and I want you to know that we all keep you in our thoughts and prayers. Today we're also reporting an additional 513 new cases. That means over the last 48 hours we've announced over 1,000 new cases, and the total number of cases here in LA County now stands at 3,518. These cases include 133 cases reported by our partners in the city of Long Beach and 33 cases reported by the city of Pasadena, which, as you know, have independent city health departments. We're also confirming today that we now have 5 cases of people who are positive with COVID-19 amongst people who are experiencing homelessness. 79% of all of our positive cases still occur among people between the ages of 18 and 65, and this number remains constant since the beginning of the outbreak. In terms of hospitalization data, to date, 733 people have been hospitalized at some point during their illness, and that amounts to now 21% of all of our positive cases. Today, there are 341 people who are hospitalized for COVID-19. 210 people are 55 and older, and 141 people are over the age of 65. 76% of the people who are hospitalized today have no documented underlying health conditions. So again, I want to stress that people in the hospital are dispersed amongst all age categories, and there are a significant number of people who are requiring hospital care who do not have underlying health conditions. So this disease does cause, in fact, serious illness amongst people of all ages. And everyone should take seriously the fact that they are at risk, not only for illness from COVID-19, but potentially for serious illness, even if they're not falling in one of what we've been referring to as a high-risk category: people with underlying illness, people who are over the age of 65, and pregnant women. Currently, 20% of people who are hospitalized today are in the ICU, the intensive care unit, and 36% of those in the ICU are 65 years old or older, and 55% of people in the ICU have underlying health conditions. 4 people in the ICU are under the age of 35. 3 people who are under the age of 35 do have underlying health conditions. You can see an update report of our LA County cases on our Department of Public Health's website. That's www.publichealth.lacounty.gov. I do want to spend a few minutes talking about cases at institutional settings. These are settings that include nursing homes, skilled nursing homes, assisted living facilities, residential treatment programs, shelters, jails, and prisons. We are currently investigating 43 institutions where they have at least one positive case of COVID-19. The total confirmed cases amongst all of the institutional settings as of today that we're investigating is now 207, and that includes both staff and residents. 148 of the confirmed cases are among residents in these institutions, and 96 are staff. We're sad to report that 7 people have died from COVID-19 who resided in institutional settings. The majority of these, they were in 4 different institutional settings, including nursing homes and assisted living facilities, and an extended care facility. We will be posting a list of all the facilities that have confirmed cases on our website once a facility has had an opportunity to notify their staff, residents, and families. As I noted yesterday, our DPH teams are investigating at every single one of the sites where there has been a positive case in an institutional setting, and they're working hard to help management and staff do their best to protect the health of all of their residents and their staff, because many of them have employees that also have become infected with COVID-19. And I do want to clarify that while I try to be as transparent as possible and provide as much information as possible, I do have to weigh that with our obligation to maintain, as much as possible, patient confidentiality. So there are some times where I'm not disclosing some information, and it's really because I don't want to risk violating the privacy of a person who's positive. So please understand and bear with us around our limitations on the reporting. I want to do an update on testing as well. As of yesterday, over 21,000 people have been tested in LA County. That's actually an underreport because we have a couple of labs that have not given us the number of people who they tested who reported as negative. So about 12 to 13% of folks are positive right now who have been tested, But again, I think that number will change tomorrow when we get all of the negative reports in as well. We'll have had more people who actually got tested, and that will bring down the rate in terms of the number of people who are positive. We've seen a lot of big improvements in testing capacity, and I want to really sort of give a shout out to Dr. Kazan and his team and all of the commercial and private labs and hospitals that have stepped up to make it easier for people to get tested. But capacity still is limited, so I ask you to have patience and work with a provider to determine whether or not it's clinically appropriate and medically necessary for you to be tested for COVID-19. We're learning more every single day about this virus, and we're really benefiting from a large group of researchers and scientists that are doing a lot of studying of what this virus is and who's most likely to get infected. But because it's a new virus, and because we're learning more every day, it also does mean that we need to pivot on some of our guidance. And there's increasing evidence, as I noted yesterday, that there are people who are infected with COVID-19 but don't have any symptoms. And for some of these people, there's also evidence that they're able to spread the infection. So they don't feel sick, they don't think they're sick, they have no signs or symptoms of respiratory illness. When they're tested, they end up being positive, and it ends up that they've also transmitted, even though they're asymptomatic, to other people. And that's the benefit we're getting from the researchers and scientists who are able to look back in time and better understand the patterns around disease transmission. This means, however, that even if you're feeling fine, or if you're around people who are feeling fine, you and the other person that you're with could be infected, and you're able to infect others, and others you're with are able to infect you. So more than ever, I ask that you adhere to the principle of taking universal precautions, because we need to assume, even if we're feeling fine, we could be infected and we could infect others.